TC going to come out with numbers later in the evening. A soft quarter expected, as Mangalam was pointing out. But with the interim budget right around the corner, Ekta tells us the key expectations from the pharma sector this time. Ekta, what are you looking at?
Well, yes, for the pharmaceutical and healthcare sector, the first thing is basically a boost in terms of healthcare spending. Now, this would likely be positive for all pharma as well as health stocks. Now, the India public healthcare expenditure currently is around 1.6 to 1.8% of GDP. And there is an expectation that, there would be a budget allocation which would be larger. So if in case that comes through, that would be a positive, maybe even up to around 2.5%. And there would be a possible expectation of a fund to build common infrastructure for health products and services which serve export as well as domestic markets. Now, rationalizing GST, if in case anything comes through on this, it would be positive for hospital as well as diagnostic stocks. Now, there could be basically, there's an expectation that they could outline a reform agenda in the finance bill aimed at the healthcare GST framework. They could also look to probably boost medical value travel by addressing the MAT credit issue, which a lot of the companies are facing and hospitals have asked for. Incentivize health insurance and preventive healthcare, early screening for diseases, etc. Reduction of GST on retail health insurance products from the current 18%. Now, another thing which is expected to be positive for pharmaceutical stocks is the expectation, it's a want, removal of import duties for life-saving drugs. Union budget should probably accelerate pace of innovation and R&D. Remember that there was an announcement for promotion of research and innovation program scheme in 2023, which was a step towards that. Also, there could be some amount of an expectation in terms of PLI, Pharma PLI. Remember that the government could possibly reject the Pharma PLI scheme to reallocate the unused 1,655 odd crores, which could be given to vitamins, anti-diabetic drugs, anticoagulant drugs. Now, this is used, this reject would come through simply because there was a component of the PLI which did not see any takers under the old scheme. And hence, there could be a reject of the leftover part of that Pharma PLI, which could be announced this budget.
Okay, well, let's also